Kidneys and liver are the two important excretory organs of the body. So I'll be explaining to you or talking to you about the seven important functions of our kidneys. So what are the important functions of kidneys? Most important function of the kidneys excretory function. Then followed by kidneys also have other functions which include control of water in our body or water balance, then control of electrolyte level in our body, then control of acid base balance in our body, then various hormonal functions. Then kidneys also are important in control of blood pressure and also they excrete many toxins. So the basic functional unit of the kidney is called nephron. So this is a nephron. This you can see this is a nephron which is formed by an afferent arteriole. It will divide into small arterioles and it will form the glomerulus. Then in the glomerulus, the blood which is coming through the afferent arteriole into the glomerulus will be filtered in the glomerulus and the filtrate is formed. This will be flowing through the proximal convoluted tubule, then it will go into the loop of Henle, then distal convoluted tubule, and finally it will reach the collecting duct. After this, it will be excreted as urine. So this is the diagrammatic representation. So this is the glomerulus, and around the this this is called Bowman's capsule. Then the blood will be filtered in the glomerulus and the filtrate will be flowing through this proximal convoluted tubule. Then it will reach the loop of Henle. Then it will reach the distal convoluted tubule and it will reach the collecting duct. From the collecting duct, it will be excreted as the final urine. So this is an enlarged representation of the glomerulus. So this is the afferent arteriole, this big one. So this brings blood into the glomerulus. This afferent arteriole, it divides into small arterioles, and that will finally from the arterioles, this blood, whatever is coming inside, that will be filtered, and there will be that filtrate will be formed. That is called glomerular filtrate. So after filtration, this blood will be going back through the efferent arteriole. This is the efferent arteriole and this is the afferent arteriole. So you can see we have two kidneys which are located on either side of the vertebral column, and these two are this one and this one are the adrenal glands, and blood will be coming to the or kidneys collect blood supply through the arteries, and through the artery, the renal artery, it will reach the kidney where it is filtered and that blood will go back into the renal vein, and the waste products and water everything will be excreted as urine. So you can see it is urine. So if you see a magnified view, I can see this one. This is the cut section of the kidney, and it will be having, if you see it in a magnified view, you can see the nephrons in that kidney, or in the magnified you can see many nephrons in that inside the kidney. So blood reaches the glomeruli through the afferent arteriole. This is the afferent arteriole where it is filtered. So the this is called glomerular filtrate. This glomerulus inside the glomerulus, this blood will be filtered. and it will be going back through the efferent arteriole. So whatever this contains, when blood enters the glomerulus, whatever uh, is there inside blood except formed elements, which means RBC, WBC, platelets, as well as large proteins and large molecular weight substances are not filtered across the glomerulus. So all things except when blood is filtered through the glomerulus, all things except the formed elements, large molecular weight substances and proteins are not filtered, and the rest of the things are filtered, and the filtrate is called this filtrate is called glomerular filtrate because it is filtered in the glomerular blood is filtered in the glomerulus, and the filtrate obtained is called glomerular filtrate. So whatever from the glomerular filtrate. So actually in the glomerulus, whatever is required by the body and whatever is not required by the body are filtered. And this filtrate will be flowing through the tubules. This is the proximal convoluted tubule. Then it will reach the loop of Henle. Then it will be going to the that way it will be going to the distal convoluted tubule and then the collecting duct. So in the glomerulus, whatever is required by the body and whatever is not required, everything will be filtered. Then the body will take back or the kidney will reabsorb whatever is required by the body. So it will reabsorb so many things like glucose. It contains so many things except formed elements and large molecular weight substances such as proteins. So glucose, amino acids, water, sodium, chloride, potassium, everything is reabsorbed in the bicarbonate. All these things are reabsorbed in the proximal convoluted tubule, and predominantly sodium and water are reabsorbed in the loop of Henle. Then there is reabsorption of many of these substances in the distal convoluted tubule also. So from the glomerular filtrate, whatever is required by the body are reabsorbed in the renal tubules. So this is another diagram which shows this efferent arteriole, and this is the glomerulus. And from the glomerulus, the glomerular filtrate is coming out, which flows through the proximal tubule, where many substances like sodium chloride, water, amino acids, glucose, vitamins, and all those things are reabsorbed. It is reabsorbed into the body. Then in the loop of Henle, actually water and um, sodium are reabsorbed. Then chloride, all these things are reabsorbed. And in the distal convoluted tubule, sodium, chloride, water are predominantly reabsorbed. Then kidneys excrete substances not only by this method, kidneys also directly secrete some substances into the lumen or lumen of the these tubules. So examples include this ammonium, potassium, H plus. All these things are secreted directly into the tube, into the lumen of the tubule. So it will flow into the urine and it will be excreted as urine. So there is tubular reabsorption as well as tubular direct secretion into the tubules, which is a method of excreting such substances. So in short, this is the renal corpuscle, which includes the glomerulus and Bowman's capsule, where the blood is filtered, and in the proximal tubule, there is reabsorption of sodium, chloride, potassium, water, glucose, amino acids, bicarbonate, calcium, phosphate. All these things are reabsorbed in the proximal tubule. Then in the loop of Henle, in the descending limb, this loop of Henle has different parts. One is descending part and ascending part. Descending is going down, and this is the ascending part. This thin descending limb reabsorbs water. Loop this thin ascending limb, it reabsorbs sodium and chloride. And also there is a thick ascending limb of leucohenley which reabsorbs ammonium, sodium, chloride, potassium, all these things, this area. And in the distal convoluted tubule, major reabsorption is for there is reabsorption for water as well as sodium and chloride. In the collecting duct, there is reabsorption of some amount of water, then sodium, chloride, water, and it also secretes in the collecting duct. There is direct secretion of hydrogen ions and potassium. So that means some substances are directly secreted into the tubules. Most substances are most substances are excreted by glomerular filtration. But some substances are and whatever is required by the body will be reabsorbed by the kidney. Then whatever is left will be left of the glomerular filtrate will be excreted as urine. Always remember some substances are, this is one method, that is, it is filtered in the glomerulus, and from the filtrate, whatever is required by the body are reabsorbed, and whatever is left is excreted as urine. The other method of excretion is direct secretion into the tubules. Then the second important function is water balance. So suppose we are traveling in a bus, so and we are not taking water. So after some time we will not feel urge to pass urine because our urine output will be decreased. So if you take less water, the volume of urine decreases. So that is a method to conserve water in our body. If you take more water, what will happen? You will have more urine. So that way also kidney will help to maintain the water balance. The amount of water in our body is controlled by the kidney. So if we take less water, less urine. If we take more water, more urine. That way, the water content of our body will be remaining same. So this uh, always remember all these solutes, electrolytes, and all those things are remaining in this um, inside as soluble in water. So when the water content of the body changes, the amount of or concentration of various solutes also will change. So, water balance means the kidneys are able to control the amount of water in our body and it will maintain the normal amount of water in our body by increasing or decreasing the urine output or urine volume. Then, by various metabolic reactions and all those things occurring in our body, so much of H plus or acid is produced in our body. It is approximately, it comes to about 4,400 milligallons per day, and kidney will help to maintain this. If this much H plus will remain in our body will become acidic in no time. So the kidney regulates acid base balance by three mechanisms predominantly. One is this whatever H plus is produced is secreted by the kidney into the tubules. Then bicarbonate is just opposite of H plus. So bicarbonate is an alkali. So in the glomerulus, bicarbonate is filtered. So kidney will, the tubules, the proximal tubule, convoluted tubule predominantly reabsorbs the bicarbonate back to our body. So that way also kidney will help in acid base balance because it will secrete H plus. So that way acid is secreted, it will reabsorb bicarbonate. So that way alkali in our body will increase and also kidney produces new bicarbonate will be produced by the kidney. So that way also it will help to increase the bicarbonate level. The kidneys are important for electrolyte balance also. So you can see the blood coming to the glomerulus. Here it is filtered and filtrate is formed. And this filtrate will be flowing through the proximal tubule where the sodium, which this filtrate contains almost everything except formed elements and like RBC, WBC platelet and large molecular weight substances like proteins. So all other things are there like sodium, potassium, chloride, bicarbonate, everything is there in that filtrate. From the filtrate, sodium, chloride, potassium, water, bicarbonate, phosphate, amino acid, glucose, everything is reabsorbed in the proximal tubule. Then in the descending limb of loop of Henle, this is the descending limb of loop of Henle, water is reabsorbed. In the thick ascending limb, substances like calcium, magnesium, potassium, chloride, sodium all are reabsorbed. And in the distal convoluted tubule, sodium, chloride, water, potassium, and some amount of bicarbonate are reabsorbed. Then in the collecting duct also there is reabsorption of various electrolytes. So this one is an enlarged picture, that's all. And you can see whatever things are reabsorbed. Not only there is reabsorption, there is tubular secretion also. Many substances are secreted directly into the tubules. One example is this one, H plus. H plus is secreted into the tubule directly. So it will be going out as along with urine. Then here also potassium is secreted, H plus is secreted. Then most important thing which is secreted into the tubule is potassium and H plus. So this will be secreted into the tubular lumen and which will be excreted as urine. So by control of this one, so that is reabsorption of electrolytes or secretion of electrolytes, the help kidney will maintain the normal level of sodium, potassium, calcium and all those electrolytes. So sodium in glomerular filtrate is reabsorbed in tubules. Almost 100% of potassium is reabsorbed in the tubules, and whatever is needed or whatever needs to be excreted or whatever is the excess potassium, it will be directly secreted into the tubules. So it will be secreted directly into the tubules. Then the next function is secretion of hormones. The kidneys are important for secretion of various hormones also. One is this renin. Renin is secreted in the juxtaglomerular apparatus and it is important for maintaining the blood pressure as well as it is important for maintaining the balance of sodium, potassium also. So renin is a hormone. Then active form of vitamin D or vitamin D3 occurs in the kidneys. This vitamin D, active vitamin D, is considered as a hormone because it helps in retaining sodium, calcium, and it is important for maintenance of calcium level. It is considered as a hormone, so it can be considered as a hormone. So vitamin D3, active form of vitamin D is called vitamin D3. That is 125 dihydroxy cholecalciferol. This is vitamin D3 or active form of vitamin D. And this is produced in the kidney. That is two for this cholecalciferol is vitamin D. When two hydroxy groups, when two OH groups are added to it, one at position 1 of the cholecalciferol and another one at the position 25 of cholecalciferol. So it will form 125 dihydroxy cholecalciferol. Two hydroxyl group OH groups are added to cholecalciferol at position 1 and position 25. The hydroxylation at position 1 occurs in kidney. So actually this other one occurs in the liver. So when this hydroxylation at position 1 occurs in the kidney, when it occurs, then only this vitamin D will become active form of vitamin D, which is the most potent form. So that is the function of the kidney. that is hydroxylation of cholecalciferol at position 1. So then another important hormone which is secreted is by the kidneys, erythropoietin. This erythropoietin is important to stimulate erythropoiesis. Erythropoiesis means generation of erythrocytes. Erythrocytes means red blood corpuscles. So this erythropoietin secreted by the pericytes of the kidney, pericytes of the kidney that will secrete erythropoietin which stimulate erythropoiesis or RBC production inside the bone marrow. So actually RBCs are produced inside the bone marrow and erythropoietin, these are the erythropoietin dependent ones, that is colony forming units, then proerythroblast, basophilic erythroblast. Production of all these things, these steps is depending on erythropoietin and it dependent on erythropoietin. So erythropoietin will stimulate formation of RBCs or erythropoiesis. Then kidneys are important in control of blood pressure also. That is because kidneys are important for that I already mentioned volume regulation. That is water balance. So whenever there is decreased volume in our body, kidney will try to conserve the volume by retaining water. So volume is important for blood pressure control. So when there is more volume or more amount of water, there will be more, the blood pressure will increase. When volume of water is decreased, blood pressure will decrease. So likewise, in sodium regulation also is another function of the kidney. When sodium is retained, when there is retention of sodium or fluids, it will increase the blood pressure. Then another thing is renin-angiotensin aldosterone system. Uh, I already mentioned this renin is secreted by the juxtaglomerular apparatus of the kidney. So whenever there is decreased blood pressure or something, hypovolemia and all those things, there will be secretion of renin by the juxtaglomerular apparatus. And this renin will help to convert angiotensinogen to angiotensin 1. This angiotensin 1 is converted to angiotensin 2, which is an active form by the angiotensin converting enzyme. This is the angiotensin converting enzyme. So this angiotensin converting enzyme will convert angiotensin 1 to active form angiotensin 2. And this angiotensin 2 will stimulate the adrenal gland mm, to secrete aldosterone. This aldosterone is a mineralocorticoid and this aldosterone will cause sodium retention and excretion of potassium. So when there is sodium retention, blood pressure increases. When there is fluid retention, blood pressure increases. That way, blood pressure control also is done with the help of the kidneys. Then kidneys are important for excretion of various toxins also. Many drugs which we take have various metabolites and all those things are there. Metabolites and various metabolic end products are there. All these things which are relatively low molecular weight. Because I told you when the blood flows through the glomerulus, most of the things except the high molecular weight substances are filtered through the glomerulus. If the so in the kidney, many toxins with a relatively low molecular weight substances are filtered in the glomerulus and it is not reabsorbed by the tubules and it will be excreted. And another important thing is these toxins should not have much protein binding. I already told you in the glomerulus, the glomerular filtrate does not contain protein because it will not allow passage of large molecular weight substances. So protein is a high molecular weight substances. So some toxins are bound to protein inside the body. Many drugs are bind to protein. So protein will not be filtered across the glomerulus. So if a drug is or a toxin is binding to a protein, it will not be filtered. So it cannot be excreted. So toxins which need to be excreted, it should be water soluble because then only it will be excreted in urine. Then without much protein binding, then only it will be available as free form in the blood to be filtered. Then they should have relatively low molecular weight because the glomerulus cannot filter high molecular weight substances. So toxins with the low molecular weight, water soluble without much protein binding will be excreted by the kidney. So that is another function of the kidney. So in short, the seven important functions of kidney are most important is excretory function, that is excretion of low molecular weight substances predominantly, that is excretory function. Then kidneys will regulate the amount of water in our body. So kidneys are important for water balance. Then they also control the electrolyte level of electrolytes in our body, that is electrolyte balance. Then it will help in maintaining or it will help in maintaining the acid base status of our body by secreting H plus, which is produced in our body, as well as by reabsorbing bicarbonate and regeneration or creating bicarbonate. It will help to maintain the acid base balance. Then various hormonal functions also are there, which include renin, then erythropoietin, and also active form of vitamin D. Then kidneys are important for blood pressure control also, and it is maintained with the help of mostly renin-angiotensin aldosterone system. Then kidneys will excrete many low molecular weight toxins which are not bound to proteins and are water soluble. So thank you. Thank you so much.